The approval of September 3rd minutes.
Motion.
Have a motion, a second.
I'm sorry, guys, can I have your last names? I know yours.
Mayor.
Yeah, I know yours. Fisher. Fisher, thank you.
Sure.
Yeah. Sir, I'm sorry, what
Shaw.
was? Shaw. Thank you. I'm sorry, I'm probably doing a poor job filling in, but
We're excited you're doing it.
I'll try.
Alright, so we have a second. Anything on the question? No, no corrections or anything like that? All in favor? Any opposed? Communications, very light on communications this month. That was distributed with the emails. The only addition I have is here, somewhere. Is an enforcement notification. And when I find it, I'll read it. Treasurer's report.
An email out, I guess there's copies up front. Spent a total of $14,413 this year with a remaining balance of $10,586. Put that over here for. On the bottom of the sheet, I've had expenditures that are still planned for this year, which total $62.66, plus whatever was spent left on vital signs. I'm not quite sure what that is yet. And there's a audit that was just completed. It's not really an audit, it's more just a financial position, more or less. And I've given one to Tony and one to Greg so far. But I've emailed it to everybody if you happen to see your email this afternoon. They just showed up today. And that's about it.
Anything for the treasurer? Medical advisory committee?
Motion to accept the treasurer's report?
The motion, we get a second? All in favor?
Aye.
Aye. Any nay? Medical advisory? Pre-hospital advisory, no report. State council, mayor.
It was gratefully sent out by Scott, who did attend the meeting. I was not able to.
Have any highlights?
I wish.
I'll hit a quick one. I'm doing this off the top of my head. I forgot to review this. Normally I print it. Do you have it handy?
I do, sir.
One thing regarding CME research, there was a lot of discussion at training and ed regarding CME research and the number of issues that are going to enforcement because of insufficient documentation and so forth in agency files. And so they now are up to, I think, full staff in the central office, and they're going to be increasing the number of reviews of applications that they get. And so this has actually been, if I could interject some comment on this, this has actually been a point of contention between course sponsors and everybody else who does the CME research, because the course sponsors are held at a very high documentation standard in terms of record retention, the period of retention, everything they have to keep in their files for each person who goes through a class, whereas John Q. Fire Department probably is supposed to be doing that but doesn't do it, and they're not reviewed as often. And that is really what they're looking at, is to make sure that any training that somebody is trying to allege for a member, that they can substantiate it through certificates, through sign-in sheets, through course outlines, and stuff like that. So there was a lot of discussion on that, and so if you do CME research, it might behoove you to look at it a little bit further and make sure that you have more than over-the-top level of documentation. So probably you can read through it because it was disseminated out, but just some of the other things that might be of interest to you. CPAP demonstration, what was a demonstration project to allow basic EMTs to be able to do CPAP. There was a demonstration project in the Finger Lakes region, and they were able to expand it to some other areas. That is now, the council approved it for basic EMTs statewide. However, don't go out and buy your CPAP equipment yet, because the state health commissioner still has to sign off on this. And so, assuming that Ebola hasn't distracted him too much, it might be sometime after the first of the year, shortly after the first of the year, but it could be longer. So you have to wait for an official directive to come out from the commissioner, but it was, the demonstration project is complete, and the recommendation was to roll it out for BLS providers across the state. And one other point of clarification about that, it was not going to be a requirement that as a basic agency you had to do it. It was going to be like all the other subsequent approvals, where you could do it if you, in conjunction with your medical director, agreed that would be an appropriate thing. A bunch of protocols were approved. We didn't have anything that was in there for approval. But of significance, our region, the Western region, is hoping that we're going to be able to jump on, assuming all goes well, on the protocols which are known as the collaborative protocols across the rest of the state. They're also known as the throughway protocols because it's everybody along the throughway that's doing it, that's kind of on the same protocol. So that would mean, like we have BLS protocols that are the same across the state, that would mean that our advanced providers would be functioning at providing the same level, the same type of care, treatments, and so forth across the state. So we would end up having our regional protocols to mirror what Albany is doing, what Syracuse is doing. And so if you ever move to that area, not that this is the reason why we're doing it, but if you ever move to the area, you know, you would not be in shell shock for the fact that their protocols are so dramatically different. One of the main reasons for doing it is that we don't have chest pain patients that are different in New York City than they are in Buffalo, and therefore we shouldn't be treating patients differently in those two regions. The other thing is that protocol revisions are extremely intensive in terms of resource intensiveness, the research and everything that goes into it, and this is a good opportunity so that we can try to focus our efforts on other things that are going to have a stronger impact on our providers and our patients in the region, and therefore why do we have to have 18 different versions of an ALS protocol. So we're not there yet, but there is an effort from this region to do that. So stay tuned, more will be coming on that. There's a lot of good things that will happen in that. I guess enough said. PCRs, if you're using electronic PCRs, they really are trying to close the loop on having PCRs at the hospital. They know that electronic PCRs, you probably don't have the ability to print something off before you leave the hospital, but hospitals getting copies of PCRs 12, 24, 48 hours after the patient's left there is really not doing any good. From a trauma perspective, the accreditation body that's looking at the trauma centers, they're holding trauma centers accountable when PCRs are not being left at the hospital or when they don't have it as a part of that patient record. So you want to make sure that you're getting it there. Same thing's going to, I suspect, come from stroke. And so take a look at your operation. Paper, make sure they're being left there. Electronic, make sure they're getting to the hospitals in a very reasonable amount of time. There might be more on that. Let's see here. The WEREMSCOs, there was an issue about CONs. Regions are reminded that the WEREMSCOs cannot vote on a pending CON application without a complete fitness and competency report. And this has been a result of some of the regions that have approved CONs pending the F&C report, but that's not permitted. You have to have the fitness and competency before this group can act on it. Legislation was passed about sex offenders. It prevents them from being a part of a fire department. However, the legislation that was passed did not include EMS-only agencies. In Erie County, there's about 6 of them. Wyoming County, you have 1, Perry, and so not a big issue in this end of the state. It is still a concern concern, but in other parts of the state, they have fewer volunteer fire departments and more of the volunteer independent type of services. Active shooter awareness, they put a guide together for recommendations for EMS response to active shooters and hybrid targeted violence incidents. You can have this, you don't have to write the whole thing down, Christina. And that document was adopted by WEREMSCO, and that's it. Oh, well, other than Part 80, or 800, I mean, unless you're...
Oh, you're on a roll.
Well, just
I don't
that...
want to stop to go, I go for it, yeah.
The Part 800 regulation amendments that were circulated out, which, you know, you can lose your paramedic card for talking on your cell phone now. But anyways, those things were, those changes were circulated. The way that they were presented to State Council was that these were just issues to help close the loop with some things in certification, that there weren't anything major. I suspect that the intent of the regulation changes didn't exactly match the wording as it was presented. I'd like to think that that's the case. But anyway, the deadline for the review on those was Monday, right? Yeah, the 3rd. That's when the comment period closed. And so what they're going to do is they're going to take all the comments back, and then they will take it to their legal people, who will then compare that with the proposed legislation, see if there's going to be any changes that they're going to make in terms of wording based on that feedback, and then once that's set, they will send it for through the regulatory process to get those things finalized. So anyway, they were up for 90 days, so it was from mid to end of September until the first week of November. So that comment period is now closed. So
90 days?
that's what it was reported as, which would not have been true. It must have been
November 10th to
40.
November 3rd.
So what is that, like 45 maybe? 45 or 60?
Well, that put us in a pickle because we couldn't address it here at the council meeting. So hopefully anybody who read your email from me got basically a response that isn't technically from the council. It's from Dr. Clemency and myself. We kind of put down chairman's underneath, but it's not on letterhead because we didn't have an opportunity to vote on it. I did send out kind of a tickler a couple days before, and I got very limited response from folks, so I didn't have an opportunity to,
You want a motion in support of the letter that you sent out?
I didn't put it on letterhead, so.
I understand that, but you sent it out, Dr. Clemency was also on it. I just wonder if it wouldn't go nice on record as saying the council supports the letter. Because you sent it all to us, you sent it to all of us, right?
I'm hoping that everybody get it. I used the email trail that Debbie uses. Did everybody get it? You have an opportunity, if you had an opportunity to read it and you want to vote on it, I'd appreciate that because it's my card. But considering what they're gonna take the card away for, this is nothing. If they wanna look back 20 years, coming in. That's the big concern, is that they're gonna go back. You'll lose a lot of responders that did things when they were younger for nothing.
Do you want to fess up to now?
I'll tell you all. And thanks to Mr. Wander for, we'll just say motivating me. With even his emails hurt to read sometimes. But Susquehanna had a very nice letter, very well written, that we used as a template for part of that. The only thing that we added was the fact that technically, according to the changes, you could reinsert your paramedic card and only respond as a BLS provider during that time, if I got it right. And we didn't think that was right. You should respond as a paramedic within that period of time. That's the only thing we really added. I took out a lot of the verbiage as far as capital and stuff like that. But you want to make a motion?
That's a
We'll all vote
motion.
together.
Motion.
We have lots of seconds. Any other question? Who hasn't got, we haven't even done a second. That's where I work. Anything else on the question? All in favor? Any nays? Thank you for that wonderful report. You can get on.
It's a good question about that report, and maybe you know, maybe you don't.
Mr.
I was shocked not to see anything in CLN in there. I mean, I know it's other provisions of the
The-
thought, but
The systems subcommittee meets, at the same time as one other group, and I didn't make it to systems. And that happens with a couple of subgroups that happen. So I pretty much rely on the seconded motions that come to SEMSCO for action, because even if something is addressed in a subcommittee, it doesn't hold water until it's
it's
approved
not-
by SEMSCO. Yeah.
I just was shocked not to see, having heard Lee's discussion when she was physically here, and
Regarding,
paring it down, making it a little more simple.
oh,
Nothing like
Too
that at
much
all.
administrative. Scott, am I right in that if we standardize, our region standardizes with that protocol, then we would be able to use their protocol, which is also an app?
Correct.
On phones.
Yes.
That's the other positive thing that's out there.
The collaborative part?
Yeah.
Oh, I think it's great, I think.
No, I do too. I just want to make everybody aware that not only is it nice to unify and standardize and that kind of stuff, but there's an actual app that would be available to us that would prevent us from having to kick in the money too. It's already been done. We don't need to recreate it.
It's always money with her. Ever notice that?
and they're taking our AEMT, we were the first region to have AEMT protocols in the state, and they took our AEMT protocols and basically are adopting them as is and incorporating them into their protocols, so that's good for us too.
Scott, with that whole protocol thing, I know some of the regions are running different medications than we're running, even on narcotics level and all that stuff. Are they gonna balance all that and take that all into consideration? Or whose protocols are they gonna take as a lead and kind of, no offense, jam them down everybody else's?
No, that's not what's
a
gonna
REACT
happen.
issue, isn't it?
You know,
Those are the logistics that they're working on right now.
okay,
The NARCs and everything are probably closer than you think they are,
okay.
but because even in our protocols, we have alternative meds and so forth, but,
Okay.
yeah.
Okay.
Okay, I did find the thing here, the letter. It's from, please be advised that the result of an investigation conducted by Department of Health, the following agencies, New York State certification, has been suspended for 3 years effective 10/24/14 for violations of previously issued stipulations and orders. And it went to Colling Medical Transport, 347 Rockaway Boulevard, Brooklyn, New York, agency code 0608. So that's the letter of enforcement that is acted for. Mr. Adolph, Erie County.
It's all Ebola all the time. And, we've done some things to try and help providers prepare. We did a provider program. I know we had, neighboring county personnel attend there. On October 22nd, this morning, we did a partners program, figuring the public health plan to implement should there be active cases locally are going to involve not just the health department, but some of our partners, predominantly the highway department for logistics and the sheriff's department for enforcement. The health department was invited, and we did that program. Our next logical progression, I think, is that we're going to start ramping up PPE training, and testing, and things like that for our agencies. We've distributed information to promote people to prepare, to develop plans. We did a cover on the commissioner's order for EMS. We tried to impress upon non-required agencies, the BLSFRs, to consider taking similar actions. We know that they're not mandated, but obviously they're just as likely to walk in on a case as our, trying to promote with our PSAPs that they're taking it into consideration when they have callers on the phone, and that we promote that exchange of information between the responders and the hospitals. In the public health side, our plan, if it can be done safely, is to actually ask people to transport themselves. So the themselves and actually minimize exposure to pre-hospital. And I think we've actually exceeded 20 cases locally that we've screened. We've had no cases that have been valid to test, so we've involved the epidemiologist directly while EMS is on scene. And in some cases, the epidemiologist is involved before EMS is even involved, because there are people that are already flagged and they're watching, so. Yeah. Those are, I think, our highlights right now. Do you have anything else, Brad? We've been pretty much all consumed with it, supporting the health department's planning.
The responders are very hungry for the information. All the programs have been very well attended. Wyoming County.
We're pretty much in the same boat as you guys are. We did do the training for the first responders a couple weeks ago. Next Wednesday, we're going to do a PPE training for all the departments in the county. And the county, we decided to purchase the PPE ourselves and then have the departments pay us for that, so everybody will be using the same equipment, so they're familiar. So that's the plan for next Wednesday evening. We're just leaning on the health department to be the lead, and we're supporting them whatever they need to do. So, we're there to help them out, so. Other than that, life is grand.
Okay, Western New York Stress.
Like I said with Bull, I lost track.
Brings its own stress.
Yeah, brings
Stress rating program in October, we'll make sure that we get, I don't know if they have anything. They typically don't run anything in December, but they do typically run something in November, so I'm just drawing a blank if they have anything this November. This has probably already been said, but Kathy Getter's retired at the end of September, and she's gonna continue to support the stress program. She's gonna do the finances for them. So that is gonna continue, but she's obviously left the office. Most of the training stuff is typically managed by Cheryl Kennedy. She does the registration. So probably there should be no change in those operations. And I apologize, we will have the statistics for that.
One thing we did add to all these in-services about Ebola was a mental health component and a conversation about what you'd expect for yourselves and the concern about family and stuff, which I think has been fairly well received by the providers, because we normally don't touch on it. Committees, budget, Mr. Carl.
Nothing at this time.
Article 30, still in progress, right? Membership, Ms. Lapp.
She's absent this evening.
Wow.
She said she had nothing for membership. I talked to her.
See you later, Ms. Dale, come back. He's right.
Again, Ebola has sort of displaced everything. However, I did put together some. Collins Fire Department actually came to us in the summertime, and they were trying to put together a BLSFR application. They had some materials put together, and I told their EMS officer, said, this is always a staged approach because you never hit it right on the head the first time. So we had a conversation about the materials she had put together, sent her away, and there was a very long delay. And in the end of July, they started to put everything together, sent it to us the beginning of September. Of course, we didn't have a meeting in September. So Ebola displaced everything and literally was riding around on the dashboard of the truck for the longest time. And this weekend when I was in New York City, I finally reviewed it. What I'd like to suggest to the group, and I have the package here, this is not a complete package for lack of about 4 things. They need verification of medical director, which is a separate state form. Scott is going to work on that for us. They need approval from the REMAC, which is standard operating procedure. Everybody has to have medical approval from the REMAC. They need, because this started some time ago, they have a December date on their letter from their commissioners, which is the authorization to provide EMS according to Article 30 within the given territory that they have approval to give it to them. That is no longer in date because all your documents have to be inside a 6-month period. So that has to be reissued. And I think there might be a discrepancy on the agency code for their ambulance. The Guam ambulance in the document has a different number than what I thought it was. Unfortunately, I missed Jim Mahalko this afternoon, so I couldn't verify it. So they have to rewrite these documents and also have REMAC approval before this is a complete package. What I'd like to do is ask the committee to endorse this contingent on those outstanding items.
Authorize you?
And then we would be on the record and we could move this forward instead of waiting till January again and let it die.
I make a motion that.
Second that motion.
No sense in slowing down.
No. This process is getting long enough.
The motion is to authorize you as the chair of the committee to accept any necessary documents and submit it to the REMAC.
Amendments. Well, the REMAC is a standalone step in the process. So they clearly weren't on their agenda because it was ahead of that curve in their sequence. But now that we've got all this other stuff, and that medical director verification form is sort of elusive, you have to look at it very closely to see that indication. Because they have all the notice of intent, and if you're looking at it, you think that covers it, but the state still requires this medical director verification form. And I think the idea, that is what they use, because every time you reapply, you don't fill out brand new notice of intent. So they have this overarching form that covers it, so when your agency comes up, you don't have to produce a new PAD form, you don't have to produce a new EPI form, new documentation on albuterol, and, all the glucometry, all the additional add-on services. So they cover it that way, but you need it in this original package.
That form was signed today.
Thank you. So, so we knew that was coming. The REMAC thing, we're always in the same thing because REMAC meets 2.5 weeks after, or 2 weeks after we meet. So there's always that delay if we have something that comes up close. So that would always be a holdup for us unless we happen to luck out and get it on the leading edge and get it before we come here.
Okay, so state your motion again.
I would just like to have a motion to authorize the chairman of the CON committee to move forward with the completed packet with required documents, amended documents.
When the package is complete,
To submit it.
then submit it to all of it.
Okay, that's your motion.
As George said
seconded.
it.
Anything else on the question? All in favor?
Aye.
Nays? Good.
Thanks.
That's it?
That's all I know of.
Well, that was easy. Committee that no report from Mr. Zimmerman. Bylaws, Mr. Glass.
What?
Morning.
Oh. Thank you for this opportunity.
Thank you for fixing it there.
And I said it the last time, but I haven't had any success with the bylaws committee getting together. What we need to do, I've been looking through these things again. We used to have a waiting list of people who wanted to get in this organization, thus being the bylaws in certain parts are antiquated it was directed at those, shall we say, prosperous times when we had a outpouring of people who wanted to be involved, who wanted to be on committees, who wanted to do some work, who wanted to run for office. So I'm gonna be looking at, not for this election, but for the next, after this election is done, at the length of terms, rather than going through this process every year for the chair and chair-elect, where we sit and everybody will look at each other and say, hey, you wanna do it, you wanna do it, you wanna do it, much less, how much as we do in fire companies. I think we're gonna try and extend, or I'm gonna propose that we extend the terms to maybe 2 year for everybody. The thought was that by doing this, all 4 positions wouldn't be up at once, but if you do the math, not the new math, but the old math, it still works out, the possibilities are gonna be there, so it'll save us a lot of aggravation. It'll give those individuals an opportunity to serve and not have to go through this every year. Then I'm also gonna be looking at possibly changing the number of terms that you can serve, as long as we don't conflict with Article 30. I have to look at that first, but that's what I'm gonna be proposing probably the next meeting, because this is, like I said, we used to have waiting lists, we used to have people, and even when people now are put on this council, there's a significant number that really don't wanna get involved and do anything, so you have the same people, the same faces doing this stuff over and over, so I think it might just help streamline a little bit if we just maybe increase the length of terms and stuff.
Okay, that's a great segue. Let's put together a nominating committee for this year.
That's under new business.
Oh, you wanna take care of it right now?
No, you're doing under new
Okay.
business.
Don't wanna miss that chance.
Yeah.
Awards, nothing. Program agency, we already have your report, or what?
Report was on the table. If you didn't have a chance to get one, feel free to grab it. I'll just hit the high points. ECMC's been going out and doing some CME dinners. It's actually just kind of an appreciation outreach. Catholic Health does something very similar in the summertime. They've been traveling throughout Western New York. The next one is coming up in Wyoming County on Thursday, November 13th. There are 71 people signed up for it already. And the folks in Wyoming County have been extremely appreciative that that there's a program coming out their way. So that's going to have ortho and neurology at it. I spoke at last month's meeting regarding the multi-agency QA committee that we're working with in North Collins, Eden, Farnham, and Gowanda. They're wrapping up. They're just doing the education piece of their QA project right now. So that'll be closed by the end of this month. And there's a second multi-agency QA group that was formed in the town of Hamburg. So all the companies in the town of Hamburg are coming together to do the same type of thing. Again, the point of this is, why do we need to have 9 different companies reinventing the wheel when we can all be working together? And it's hard to satisfy the requirements of a QA committee within your own agency, because most of the people, frankly, by the way the law reads, shouldn't even be members of your agency that are on your QA committee. So this gives you an opportunity to utilize each other's resources and not have to struggle very hard to meet those requirements. So that's been actually a very successful program for us. The EPCR administration meetings, very good attendance, even though you look at the numbers 13 and 10 and think that's low. The point of this is just so that the administrators from each of the agencies had an opportunity to see some of the backside of the system that New York State uses for the bridge, and meet Mike Taylor, who administers the electronic system for all of New York State. Of other significance, the RE/MAX skills and expiration date reporting requirement. The skills had to be done by June 30th. They had to be reported by August 1st. I provided a report in September of the agencies that were non-compliant. On the back of this report are the outstanding agencies that still have yet to comply. 2 out of the remaining 6 that are on here, we've had contact with the agencies and should have reasonable assurance that we're going to have this information. The RE/MAC has basically left it up to the program agencies to determine what the course of action is going to be. The directive was that they really wanted agencies offline by November 1st, and then, well, Ebola happened, and so I'll, just in full disclosure, we did not meet that November 1st deadline. But I did work with the REMAC chairman and also Dr. Walters from the Southwestern region. We had hoped that because we were acting as an agent of the REMAC, that the REMAC would have a standardized notice that we could send on their behalf. We'll still capture the information. What I didn't want to be was the REMAC police and make it look like it was Scott Wander gone wild in the Western New York region. So, any more than I guess people think. But, so anyway, that's where it's at right now. They agreed with the concept, but they haven't agreed on the content. But we are under crunch time because this needs to be finalized by their next meeting, which is 2 weeks from yesterday. So that would give agencies 10 days. We just want to avoid doing the letters. That's really what this is. I don't want to send nasty grams to agencies. I'd rather reach out to somebody, work with them, and get it finalized. And let's not send the thou shall letters out. I did talk before about stroke center requirements by January 1st, 2015. EMS, we're going to need to perform, document, and include pre-notification in our reports. Within that, make sure you're documenting and encourage others. Make sure they're documenting the Cincinnati pre-hospital stroke score in their reports. The time when they're pre-notifying the stroke center, which could be your MERS report, or if you're making a medical direction report or whatever report you use in your system. And then the date and the time that the patient was last known well. Stroke centers are being held to that standard. Other than that, the only items that need action by this group is that Evans Center Fire Company is downgrading its highest level of service from EMT Intermediate to EMT. They're not going to be going to the 8 EMT level. And then the other thing is that Lancaster Ambulance is changing from EMS charts to Zoll. Actually, I should say they already did it and did not realize that they needed formal approval to do that. So, Regional Council and the REMAC both take action on that.
To approve?
Yeah. Any questions?
Any questions for Scotty?
Scott, I have a dumb question maybe. Why does the REMAC have to approve if they're changing from one EPCI to the other? What's the thought process?
Because the REMAC is involved in they're authorized to have access to the information, and they might make certain impositions. We don't do it in this region, but there's other regions that the REMAC will set specific parameters that you have to use within your documentation, and they have that ability to do it. And so they're just one of the people who have to do that.
So they could implement closeout rules is what you're saying?
Among other things, yes.
Okay.
Yep.
Thank you.
Do we have a motion to accept that?
I'll make a motion.
We have a motion to accept the change. We have a second. Anything else on the question?
I'm sorry, who said that?
Last, unless you put scratch the second. Anything else on the question? All in favor? Any nays? All right. Program Agency Steering Committee?
We haven't had a chance to meet, but just one thing I gotta ask, and that's the website. Can we get that updated? It's currently not updated, and the membership and the chairman.
We, and actually the meeting time is wrong on it, which was identified a couple days ago, and I emailed our administrator to get that changed. I didn't look today to see if that was updated. The membership, we just need an updated list from the membership group to let us know who's up when, and we'll make sure that that gets done.
Alright, and we're gonna try to have a meeting, JT and myself, to go over the contract and look at a few things, and then I'm hoping to get a meeting with Scott as well, so we can review a few other things.
Old business, vital signs. Make sure you get all your bills into Neil. Anybody have an idea of attendance? Did you hear anything?
Yeah, it didn't look very very strong.
It was up from Buffalo though, right?
Rochester.
I don't know.
It was up from the Buffalo one.
Oh, I don't know.
Wasn't it 1700?
It didn't
That's
look,
what Lisa
well,
told me.
it's hard to say,
Was
though.
that high?
The morning opening sessions, that was very well attended, but,
Mhm.
I mean, the amount of vendors was
I think the
Pretty-
vendors was down.
pretty poor, to say the least. Unless you were selling T-shirts or,
There were two
or
helicopters.
an ambulance or a
Yeah,
building.
Not a lot of good free stuff either.
Oh, so much for Christmas shopping. All right, new business. Like to form a nominating committee? We need one from each county. You could calm down. You can either offer, or I can appoint.
You,
I'll give them a chance. Is anybody interested? You'll chair. I've already got you marked. We got Mr. Shaw and Ms. Fisher. All right, thanks so much. Sorry that was so difficult. Any other business?
I know, you're showing symptoms.
Do you have anything you wanted to address the group, or you just,
we need to open nominations tonight also.
we have a guest here, I neglected to ask if you had any comments or
No.
questions.
I'm good.
Well, in case you haven't noticed, it's one of us. All right, go ahead, go with your nominations.
The positions for, and the way this is written, even though we take nominations tonight, it's open-ended, so it's gonna be the pleasure of the council whether we want to let individuals submit their name for consideration and vetting to the committee before the next meeting. So we'll do the off the floor first, and then it'll be open to whoever wants to, well, I'll address that after. So for, open nominations for chair,
I nominate Greg Gill.
is there a second?
I'll second that.
Do you accept?
Oh, yeah. Keeps me out of having to buy the food, yes.
Any nominations for chair for the second time? Nominations for chair for the third time? Need a motion to close.
So moved.
Make a motion. I'll second it.
2020.
For chair-elect, we have Tony Santoro.
I'll make a motion for Tony Santoro.
I'll second that.
Do you accept?
Sure.
That's it up here.
I don't know if I have to sit up there, I don't know if I will.
Just turn the chairs around, you can be in the head.
Yeah, we could put it back here.
Open, our chair-elect, call for nominations for chair-elect for the second time. Call for nominations for chair-elect for the third time.
Make a motion
Need a motion?
to close and the secretary cast one ballot.
No.
Can't do that?
Can't talk about that.
Okay.
No, we're just.
I'll make a motion.
We go next.
Gentlemen, are you up? You're not up, are you?
I think I am.
Oh, no, check the paper.
He's, Chris is, but I couldn't remember if you were or not, and I was looking through minutes and I can't find it.
I think I am.
Oh, thank you, sir.
Or you can.
Well, we just covered it, let's just,
All right, for treasurer,
We gotta make the, we need to.
I'm not allowed to be
Close
opposed.
the ballot and, I just made a motion for a second.
he's second.
I second it.
Okay, I got it. And the, for treasurer,
But I
I
want to
need
get
a
out.
motion?
I'll
Right.
nominate Neil. Thank you.
No,
No?
be kind. I gotta get out.
Just stick it with your throat.
He's declining, Neil's declining.
Fine.
Anyone want, treasurer?
Did Neil take it again?
You want it?
I nominate Cheryl Marin.
I live in that world every day, I don't need it now.
That's all the better.
Keith Myers.
Nominations for the second time?
Is there a county
is there still a county thing on that,
Motion.
secretary, treasurer?
I make a motion to close.
What do we do? I'll second that, sure.
Would you consider staying on until we can find someone?
Is there a thing,
Well, it's
county,
still open, it still could be
one
nominated on the
secretary,
floor in
one-
Well, and
January,
this
correct?
is what we have to talk about now. And right now, what we've done in the past, and again, the way this section is written, it doesn't specifically state it, but it's open-ended that if the council wants to let individuals submit their name to the nominating committee before, we'll put a deadline on it sometime in December that they'll give us time to vet and make sure they're okay. We can do that. It wasn't specifically written in there because it was, we didn't want it locked into a bylaw, but there's that open-endedness in that we can do that if the council, if the body so desires.
Aren't you the nominating committee chair? Are you the nominating committee chair? Can't you just decide?
No, that's gotta be a body, yeah.
Your motion.
So do we want to, well, I would move that we give the, because of the low turnout tonight, we give any other individuals on the council who wish to run for an office, the three that are open, chair, chair-elect, and treasurer, the opportunity to do so by December 20th.
They can't be nominated from the floor then at the January meeting, or they can?
We vote January.
But there's no floor nominations at the January meeting?
No, the floor was tonight.
Okay. I didn't know if somebody can come later and say,
Well, that's why this is, now if they want to, they can submit their name. We'll look and see, are they eligible?
sure,
And then I will put them on the slate or the ballot, whichever one call it,
sure.
for the January meeting.
Good with that?
Now,
All right.
Carlo's not here, but action-wise,
Robert's Rules of Order.
yeah, can you put somebody in it, vote it, be done, so that you have your slate, and then that person can back out, and then you can appoint?
But we're not going to January.
Correct.
I understand that, but I thought you just said that they had to be included like now,
He's saying give
in
them more
order to be
time.
on
No,
the
we're
slate,
gonna
in order
give
to be
them,
January.
we're gonna give them December 20th, because
The
the
low
secretary will put out a notice that if you're interested. But right now, we have two people running,
Right,
but we can still, if the body so chooses, to let them do that.
I thought you were looking for a name today.
No.
So the motion is by you to have council members email you, the nominating chair, by 12/20 if they're interested in running for the 3 open positions.
For any of the three.
Mr. Black? Just so I'm also on the same page, you want them to email you by the 20th so that we're not putting them on, or trying to put them on the ballot at the January meeting when we're voting, because then we would not have had a chance to make sure they were qualified, correct?
By the
That's
20th, that's
Correct,
why,
but-
by the
But
20th.
that's
so
why you
that-
can't do it in January.
Yeah.
That,
And
just
the committee
Yeah,
won't have a chance to see if
correct,
they're,
because if we did it in January at the meeting, we wouldn't have a chance to look at them before we voted.
and wouldn't be able to make up the paper ballot.
Correct.
The official paper ballot.
Yeah, there's paper ballot. If there happened to be an open slate or open person, does the chair have the ability to appoint for that position?
Most places they are, yeah. Then I would-
But I already asked Neil, he said he would stay
Stay
on
on
until
until-
we could find someone interested in,
Which we would have just appointed him anyway.
That's what I was kind of.
maybe Madonna or something.
I did it to her last
Well, I think she's done it before, but I
We
don't
have a
know.
motion that's seconded. I'll pick on the question. All in favor? Any nays? All right, next order, please. You set?
That's it.
Is there anything else for the council?
Make a motion, we adjourn.
We have a motion, don't need the second.